you're going to use tap water. And the tap water has to be at room temperature. You don't want it too hot, you don't want it too cold. So I always have the students measure up the water a while before we're going to do that, so it starts to get to room temperature. The first thing that you're going to do is assess your patient and find out if they're having any nausea, if they've had any emesis, if they've had any diarrhea, because maybe you wouldn't even go to this point. At St. Joe's, the way we check placement of NG tubes and G tubes is with auscultation of 30 cc's of air. I've got gloves on. Don't you see them? They're invisible, but you're going to want to make sure there's enough slack here that it's not moving around in your patient's nose. You're gonna go like this to stop. You've already drawn up your air, and this wasn't just laying there. That was in the nice clean spot. You put your stethoscope over their stomach, and then you're going to whoosh it really fast. Because if you go slow, you won't hear it. So, oh, look, I heard that. That's wonderful. So now you take this apart, put this back on, and then start drawing up your feeding. I mean, you could do it all at once. You could just hold that, but sometimes you need your hands. So now I'm drawing up the feeding, the flush. Wait a minute. Can you stop that recording?
You do.
Okay. So we just did the whoosh, and Brittany reminded me. So we did the whoosh. Now we're going to check for residual. And residual is just feeding in the stomach that hasn't been absorbed. Anything 100 and lower, you're probably going to give the feeding. If it's 100, which would be 1.5 of these syringes, then you would hold the feeding and call the doctor. If you keep pulling back this residual, so you fill up this whole syringe, and you put this in an empty cup. We're going to pretend this is an empty cup. So I go, okay, there's 60, and I do it again, and it's 120. This whole thing's filling up, and it keeps going, and you're like, what is the deal going on here? By now your eyes are getting nice and big. We do another one, so 60 times 3 is what, 180?
Mm-hmm.
Okay, you're like, okay, we're not giving this tube feeding because they're not absorbing. This is all staying in their stomach. But according to St. Joe's policy, there's 180 in here. We have to feed back 150. And we're going to throw the other 30 cc's in the toilet and count that as output, 30 cc's. This is stomach content, acid, electrolytes. That's why we're feeding it, so that we don't interrupt the electrolyte imbalance. It's really throaty what you see in there, though. It doesn't look like it does there.
How will you know when to stop trying to get it out?
When it stops. Yep, you'll have a resistance. You'll be like this, and you keep pulling back, but nothing's happening. Then you know you've reached your the end. But you have to make sure you know what that residual is. So hopefully, your patient only has 30 cc's of residual, and you're like, oh, phew, good, I can get the feeding. Then you're going to refeed it, clamp this off, and then start your tube feeding. Your tube feeding is a formula called Longevity. You always give it full strength. You pull up, and you're going to give 240 cc's. You're going to give 4 syringe fulls. It's going to take you a while because you don't want to do the dumping syndrome. If you put in formula, especially, it's got to be room temperature. You put formula in really fast. That's like someone hasn't been having food, giving them a huge amount of liquid all at once. They might get nauseous, they might have diarrhea, they might vomit, and if they vomit, there's a good chance they're gonna aspirate. So you're gonna either give it to them by putting it in the syringe and injecting slow, or the way we taught you was the gravity flow. Remember to try to keep the inside of this syringe clean. So we would go like this, and then we would pour liquid in. And then if we wanted it to go a little higher, we would raise it up. But that's a little too fast, what I'm doing. And if we have to give this all, then you don't have to worry about measuring, because you already knew how much was in there.
So if you had to measure it, would you keep it clamped and then measure it in the syringe?
Mhm.
Okay.
Which way do they want us to do it for the lab?
Probably like this.
Pre-measure it and then put it in.
This is called gravity. So I think what Brittany's saying is, do you want us to do it by gravity, or do you want us to use it by push, right?
Yep.
See, I can read you.
Mhm.
Then after you're done giving the feeding, you're gonna give a flush, and it's usually 30 cc's, and it's tap water. So everything's gotta be at room temperature, and you've gotta, if you don't clamp this off by doing this, those stomach contents are gonna come back. You don't wanna wear a face shield. In reality, in the hospital, there's a stopcock right here, and you just turn it towards the patient, and it says stop right on it. And then you do all this and turn the stopcock around, but we don't have one on here, so you gotta do it the way. But I think that threw Garrett when we did it, because he's like, what is that?
Yeah.
And I said, once I walk you through it, you'll be fine. What you need to practice, more than anything, is just maneuvering this syringe. Taking this out, doing the clamping. Like, see how I'm pretty used to it? But I'm used to this. But when you try to do it, you're gonna say, I need 6 more hands in order to do that. So that's what nursing needs. We all